let me just basic about pathway, the patient pathway discharge and 90. Are you aware of this? Are you the discharge?
The patient pathway.
Yeah,
it's a doctor-led. A clinician has to discharge someone from hospital, and then lots of other agencies have, if that person has particular needs, has to pick up to ensure that they've got a home to go to, that they've got the care and support they need.
Okay, so just to show everybody there, I'll just make sure get your voice back in there.
Yeah.
So on the screen you can see that the discharge to assess model is based on using the 4 clearways. So this is a big massive push. So the government did ask for 250,000 volunteers, which they got, I think, over 500,000 in the end. And this is what it's all to do with. So if you're going into the hospitals, you might not exactly see a lot of people there, but I do have a worry. I have worked in the NHS, by the way. I've worked with CRS project. That was a massive care record system, and I know how some of these flows work, and it does worry me because of the amount of people who back then, we're talking quite a few years ago, how the system actually works in the NHS. So we've got 50% of the people simply discharged, whether they want to or not. They're just being sent at home, with 45% of the people support to recover at home, able to return home with support from health and or social care. So that's a lot of people from a hospital being sent home, isn't it, really? With 4% of people needing rehabilitation, they're going to go into social homes, care settings or whatever. It might not be their place where they would like to be, but it's just about getting them out of the hospital. And then 1%, obviously, they've had ops done or any other ailments, and they do need to be obviously looked after, so they have to be held at the hospital. But I've also heard things from people who work as private ambulance people who have been utilised as part of this initiative, where they're saying they've been asked to take on 2 people or 2 patients. They come out with a mask on, but they don't come out with any gloves, which to me, the ambulances should be obviously staying sterile, so to speak, or unless they wash it down after every turn. But so you've got the driver, you've got the person who looks after the patients in the back and sits in between these 2 people, and 2 metre rule isn't really going to count. Do you know anything about that, or is that
I haven't, but I can certainly take that up with the healthcare trust as to how that is working in practice. I mean, what I know from Buckinghamshire as a whole is that there is still capacity in all of our hospitals. Obviously, the main 2 being Wickham and Stoke Mandeville.
So when you say capacity for COVID or for just
COVID capacity, ventilator capacity for anybody presenting with COVID symptoms. Likewise, Buckinghamshire Healthcare NHS Trust have slightly reorganised the way services operate across Stoke Mandeville and Wickham to maximise their ability to ensure that people who are still sick and need care can access it if it is not COVID-19 or the symptoms of COVID-19 that they are presenting with. I mean, for example, one constant that the NHS can't do anything in terms of saying, well, this can wait, because it clearly can't, is that many women are giving birth. And so they have moved all maternity services to Stoke Mandeville. So anyone that was planning to give birth to their child in Wickham Hospital is now being asked to go to Stoke Mandeville, so that they can ensure that there is that centre of excellence at the Aylesbury Birth Centre and the labour wards at Stoke to ensure that mums can give birth safely during this crisis at that birthing centre. So the Healthcare Trust have done a lot of very careful planning, a lot of medical-led planning to ensure that there are as many services as can still be offered on top of caring for those with symptoms of COVID-19 at this time. So it's not a case that simply all other hospital services have been turned off, but obviously there has, out of public safety, had to be some rationalisation and change in the short term while we get through this crisis.
Yeah, but this document clearly states 99% of hospital patients are going to be discharged or have been discharged? And is there anything is there any information or obviously charts and figures and graphs regarding how many people have been moved and how many people, has anybody died from this scenario? Because I'm sure there is families out there who are impacted by this move. I mean, especially sending people home. And again, I must reiterate to people, I've looked at this information and it clearly states in this document, all funds will be available to all hospitals to do what they can to move these people. So I'm not having a go at the government. I'm merely just overlooking and making sure that certain avenues are looked after. And this is a case of people who are not COVID. They've been told to, they're going home whether they like it or not. And, making, is there any checks and balances? It does say that there is, but where are all the stats to show that people are being looked after? Yeah, there has been.
Yeah.
I'm sure people have probably passed away, unfortunately, in this mass exodus of patients from the hospitals. So I've not seen any of that information.
Well, what I'll say is, in all the briefings I've received, I have not been told of anybody who has lost their life because of a change in the way the hospitals are providing services. Okay. Now, I will follow that up with the Healthcare Trust to get the most accurate information as possible for you. Certainly, I have not seen in any of the briefings I and other Buckinghamshire MPs have been given that to be the case. Yes, we've seen changes like the maternity changes I just outlined. I have not been briefed on any statistics around loss of life through that. What the government has said is that elective surgery is postponed, but urgent surgery should carry on. And indeed, I've actually represented to government a couple of cases of people who actually were due to get treatment in the private sector, cancer treatment particularly in the private sector, who, because private hospitals have all substantially shut down, need to now access that treatment in the NHS. And so I can assure you that the NHS are taking in urgent cancer treatments and ensuring that people that need that urgent treatment are getting it. Okay,
all right. It's interesting you said that about the private sector. That's very interesting that they've closed down. I would have thought they would have been.
Well, they've essentially turned over to some private hospitals. The private hospitals, to clarify, aren't running as they normally run. So some private hospitals, they've all essentially become part of the NHS for this crisis. And the NHS is directing what should happen in them. Some private hospitals are becoming entirely COVID-19 hospitals. Some hospitals are carrying on with treatment plans where they can, where they're properly and safely equipped to do so for other urgent surgery to ensure that healthcare across the piece is happening, but it's all being done under the clinical direction of the National Health Service.
Okay, so is there information out there to direct people to say this is going to be COVID hospital and this is going to be other services?
Yes.
Yeah, okay.
Yeah, I believe that is in the public domain. I mean, I know that, for example, the private hospital in Great Missenden is taking on a lot of the cancer treatment that they're equipped to do for the county, freeing some of the NHS sites to focus more on COVID-19.
Like I said, I worked in the NHS and I know how hard everybody does work there, and it is understandable that they're going to be under tremendous strain, especially with something like this where you're basically the exodus of 99% of patients in obviously the COVID hospitals, I suppose, in a way that you're saying. So that's interesting. We've got a few people putting questions on, which we'll actually have a look into that in a moment. I mean, their quote in that document, by the way, was why not home? Why not today? Discharge day should be the default pathway. So that was the bit about that. Going back